Charcot arthropathy, Charcot joint or the Charcot foot. Charcot foot can result from complete or near complete numbness in one or both feet or ankles. So this condition causes the bones in the foot to become weak, making them prone to damage such as fractures and dislocation. Because the foot is numb, pain from fractures or other traumas can go unnoticed, leading to additional damage from the walking and standing. As the bone continues to weaken, the joints of the foot can become dislocated or collapse, changing the foot's shape. The resulting shape is referred to as rocker bottom foot, since the arch extends down and out, creating a rocker-like appearance. When speaking about the symptoms, the Charcot foot symptoms has the first stage it has three stages. The first stage is fragmentation and destruction. This acute initial stage is marked by the symptoms such as redness and significant swelling of the foot and ankle. This area may also feel warm or hot to touch when compared with the other foot. Internally, soft tissue swelling, small bone fractures are starting to occur. The result is destruction of a joint and the surrounding bone. This causes the joint to lose stability, resulting in the dislocation. The bones may even jellify, softening completely. During this stage, the bottom of the foot may take a flat or rocker bottomed appearance. There are also a bony protrusions, that is a plantar prominence, may also appear on the bottom of the foot. If not treated, this stage can last for up to 1 year. While speaking about the stage 2, coalescence, during this stage, the body attempts to heal the damage done during the first stage. Destruction of joints and the bones slows down, resulting in the less swelling, redness, and the warmth. And the next stage, the third one is reconstruction. During this third stage, final stage, the joints and the bones of the foot heal. Unfortunately, they do not go back to their original condition and shape on their own, but no further damage is being done to the foot. It is often left in the deformed, unstable condition. The foot may also be prone to the formation of sores and ulcers, which might lead to the further deformity or in some other cases the need of amputation. Causes. Charcot foot causes. This occurs in the people who have the numbness in the feet and the legs. This loss of sensation is the result of type of nerve damage called peripheral neuropathy. Charcot foot is most closely associated as a rare compilation of diabetes, but peripheral neuropathy is associated with the several conditions like diabetes, alcohol use disorder, drug abuse, Hansen disease, that is leprosy, syphilis, syringomyelia, and polio. Diagnosing the Charcot foot. During stage 1, the Charcot foot may undergo undiagnosed since X-rays may not yet pick up on the damage starting to occur. For this reason, it is important to let your doctor know if you have a medical condition that might result in the Charcot foot. In its later stages, when it has progressed, imaging techniques such as X-rays and the MRIs can also be helpful. In addition to analyzing your symptoms, your doctor will check for the signs of neuropathy via a physical exam, a review of your medical history, and test. This may include Sims-Winston 5.07 per gram monofilament test, which analyzes sensitivity to pressure and touch in the large nerve fibers, pinprick test, which assesses the ability to feel pain, and neurometer test, which identifies the peripheral nerve dysfunction such as diabetic neuropathy. Your doctor will also test your tendon reflexes and analyze the muscle tone and the strength in your leg and foot. Treatment for the Charcot foot in its early stage is geared towards reducing swelling and heat in the area, as well as stabilizing the foot by keeping it immobilized. It is important to eliminate any weight or pressure on the foot to stop additional damage from being done. This is sometimes referred to as offloading. Several low-tech non-surgical treatments for Charcot foot may help arrest its progression. These include wearing a protective splint, walking brace, or customized walking boot, minimizing or eliminating all weight on the affected foot by using a wheelchair, crutches, or a walking scooter. Use surgery, your doctor may recommend the surgery if your foot has become significantly unstable or if it cannot be braced or supported in any way. You may also require the surgery if you have a sore or ulcer that doesn't heal. Surgery techniques include reconstructive osteotomy, also known as realignment bone surgery. This procedure shortens or lengthens the bone in the foot or ankle to alter its alignment and ability to support the joint. A surgeon shortens the bone by cutting it or lengthens the bone by adding a wedge of bone to it. Next one is ankle fusion. This procedure uses screws, rods or plate to lock the ankle joint, prohibiting the motion. Exoptomy. This is the removal of a plantar prominence which might cause the ulcer to form. And the next one is amputation of prosthetic fitting. The foot or portion of the foot is removed, followed by fitting on the for the prosthetic device. Preventing the Charcot foot development. It is possible if you have a diabetes. Keeping your blood sugar level under control can help reduce the nerve damage. People who have the diabetes or who are at the risk for the neuropathy should avoid the damage or trauma to their feet whenever possible. Avoid sports or exercise that may impact your feet, such as kickball or soccer. Do self-examination daily to check for all the symptoms. If you misuse the alcohol or other substances, a 12-step program on the intervention such as rehabilitation setting may help to stop the behavior that is putting you at risk for Charcot.